Welcome to the NanoCap podcast. I'm your host, Will Chernlin, and I'm excited to have you join me on this journey through the world of NanoCap companies. For the past decade, I've talked to thousands of business owners across various industries. It's been an enlightening experience revealing the vast tapestries of entrepreneurship and innovation that thrives beneath the surface of mainstream media coverage. Each week, I will interview different leaders of NanoCap publicly traded companies to learn about their history, what they do now, and their future. As a reminder, none of this information is financial advice, and it is all for entertainment purposes only. Let's start this week's episode. Hi, everyone. On this week's episode, we have Simon Szewach, the executive chairman and co-founder of Gelteq, stock ticker GELS. Gelteq is a global leader in the revolutionary science of ingestible, gel-based medications, nutraceuticals, and sports energy. Simon, thanks for coming on the podcast.
Thanks, Will. Thanks for having me.
So I usually like to start with people's LinkedIn, kind of a little bit more of their personal journey. You have kind of an interesting one. And then tell me a little bit about your experience of being a co-founder in the past and then getting acquired and becoming public. Tell me a little bit more about that and then how just being a public company in Australia is different than the US.
Well, look, we are a public company in the US, so I should probably start off by saying that Gelteq is traded on NASDAQ. So we are trading in the US. All the origins and the business and the technology all started back in Australia in about 1998. Look, it's a very different world in Australia. We sort of start a lot of the initial work over there. We've partnered with Monash University to help get the science and the technology and the R&D all working properly, and then we start commercializing and rolling it out and then taking the next step into the US. As far as a co-founder, look, again, it's all about finding the right people. I've been very fortunate to find an incredibly good partner in my co-founder and CEO, Nathan Gavoni. We both have very different skill sets. I'm more the sort of the commercial sales guy, and Nathan's very much the science and operations guy, but again, taking on the CEO role as well. So he's fantastic. And again, you're only as good as your partners. You're only as good as your weakest link. The Gelteq team's incredibly strong, led by a very good CEO.
So you mentioned that it was started in the late 90s. So we'll get into it now. Like, what is Gelteq? What did it start off as? And kind of what is it now?
Yeah, great question. Look, Gelteq started, I think, in 2018, so about 6 years ago, down in Melbourne, Australia. It was born out of an idea of there are a lot of people who can't swallow existing pills, powders and tablets. Over 1 billion people suffer a condition called dysphagia, which is a real problem to swallow these things. And I met my partner, Nathan, and we thought there must be an easier way. It must be able to, find a better solution for people to actually take their courses of treatment. And we developed a new solution which utilizes the power of a gel base that we developed, which acts as a complete replacement to people taking those pills, powders and tablets.
So on your website, you have a really good table on your website that shows kind of what makes you different than gummies and pastes and drops and pill tablets. One of the things that you can do that it seems no one else can is the ability to hold and deliver large dosages. What does that exactly mean? And like, why can't I take a big dosage of a pill? Or can you explain that a little bit more?
Sure. So you're limited by the size of a gummy or a capsule in terms of what you can actually put into it. The gel pouch can be anywhere from 20 mil to 300-400 mil. So we can actually put a much higher dose of things into a pouch. We can also put a lot more ingredients into it as well. So stock it up to make it a lot more, a lot stronger gel in terms of incorporating a lot more ingredients and having a much higher dose into the pouch itself and still being able to deliver it in the right way.
And then compared to like the spectrum of just like taking a pill normally and an IV, about how fast does the product absorb via the gel?
Look, it can be faster, it can be slower. Again, another benefit of our technology is we can release it in different areas of the gut. So we can actually have a faster releasing gel, or we can have a slower releasing gel.
And what can you basically turn any medication into gel? Are you starting with a certain medication that is easy to turn into gel? Or like how do you guys figure out kind of R&D or what markets you want to go after next?
Yeah, look, we play in a series of verticals at the moment. So we've got about 70-odd formulations available for white label today. And they're on the non-pharmaceutical side. So they're really focusing on nutraceuticals, the sports space. Also in the pet space, we have a series of products that series of gels for animals. If you've ever tried to give a dog or a cat a tablet, again, we solve that issue. So that's part of what we currently do today. And that's really going out and white labeling those 70-odd gels across those verticals, human health as well, things like that. And then we also work across the pharmaceutical space, and that's working down the B2 pathway, which is that accelerated FDA approval space where we take existing medications, existing drugs, and we turn those into FDA approved gels.
Very cool. So let's walk me through that a little bit so a company that sells, for example, pet pills, and they come to you saying, we want a gel version. Do then you have to have like your chemist meet with their chemist to make sure that like certain things aren't doubled up on or combined when it turns into a gel, or you have to make sure okay, we want this to absorb quickly, but we want this not to absorb quickly? Like, how does that process go, and how long does that take? That seems like that could get pretty complicated.
How long's a piece of string? I mean, look, the benefit really of our technology is we can actually develop new products and have them on market incredibly quickly. So we have about 20 pet-based products now that work across a series of the most common issues facing dogs and cats, so everything from joints, anxiety, weight loss, things like that. But if there's something new that a client wants or someone in the pet space wants, they'll sit down with us. We'll then take it to our in-house R&D team. So we have run a full-time laboratory at Monash University down in Australia, and we'll work to incorporate their requirements. And within 2 to 3 months, we should actually have a new gel on market. It might take a little bit longer depending what's in there, but the technology itself is incredibly fast and flexible, so we can practically put almost any compound into these gels and keep them stable.
And so you say practically, is there a specific like pharmaceutical that you're saying, hey, that's just never going to be gel based? It just doesn't make sense from the point of view of you would need too much, or that you would just, it's too expensive to figure it out, or what's kind of like off limits? I'm just kind of curious.
Look, anything that's IV related is probably off limits because it absorbs in a different way. But as far as most of the compounds, we can practically work with anything. We haven't found anything to date that sort of doesn't fit within the gel space.
No, and the pet one especially resonates with me. My dog has very goofy teeth. And so even if you tried, so yeah, in the near future, he might be getting some sort of gel version of his drugs type of thing. So no, I'll definitely be thinking of you.
Exactly. Well, look, all those supplements that we've got available now for, again, the anxiety, the weight loss, the joints and things like that for the dogs and the cats, again, they're based on a series of fish, beef, chicken flavors, and you just pour it on top of the food and they eat it up with their food and it's done. So again, a much easier way for delivering those supplements at the moment.
And then, since you mentioned it, for the human side of things, what are the flavors?
Many different flavors depending on what products. So again, with the 70-odd products, each of the products have different flavor profiles. So we have everything from citrus-based, fruit-based to chocolates, vanillas. It just depends on the type of product you're after.
So you could have like maybe 70 SKUs, but then maybe 5 variations of each SKU based on all the different flavor combinations kind of thing.
Yeah, and again, depending on what the client wants. So it's important to note that Gelteq as a business, we're not out there selling our own products. So we actually white label. We work with third parties who actually want to develop a new gel base. Again, they've already got the reputation, they've already got the branding, the customer base, and we just develop the new products and help them actually develop a new innovative solution that they can put on market. So for us, we're not out there selling our own products, but we are working with a number of third parties.
And are you manufacturing the product, or are you having the actual like drug maker manufacture it and you're just helping them with more of the formulation and licensing?
So on the drug side, it's a bit different, and that's something that we're working through FDA approvals at the moment. So that's a separate SKU of work that will sort of start showing fruit in the next 12 to sort of 15 months, and that's when the FDA processes and things will happen. But on the nutraceutical side, we manufacture across the US, Australia, and in Asia.
Very cool. So you mentioned that FDA kind of approval and waiting for that just to be able to do some next steps. So what would you think Gelteq would look like 5 years from now if everything goes to plan? Would it be you now have 500 different gels that you're licensing out to different people? Or is there like a specific holy grail? Like if you guys can get a GLP-1, then that will just be the main focus of the business because it doesn't even make sense to focus on other things. Or how do you look at that?
Look, I think the benefit of what we do is, as I said before, incredibly flexible and functional. There are a number of pills taken across daily life and powders and tablets. So again, I see a number of verticals just growing. I see the pet space growing. I see the nutraceutical side growing, looking at potentially the compounding and personalized gels and things like that in the future. But also I see the pharmaceutical side, and I see this as a delivery system solves so many problems and helps so many people that I think once you start rolling out different drug-based gels, the possibilities are endless. It will just continue to grow. So in 5 years' time, again, the pets, the nutraceuticals, all of that will continue to grow. But I do believe there's going to be quite a large adoption to gel-based drugs.
No, I can definitely see too, like any drug that's involved with any sort of like hospice care should just be gel-based first.
Yeah,
Right.
look, aged care, absolutely. A lot of people can't swallow, right? And as you get older and certain medical conditions, cancers, COVID, things like that, again, the ability to swallow is greatly reduced. And this just provides a much better solution for those who can't swallow existing medications.
And so because of that, like, you don't have to get too much into the weeds, but do you have like a priority list of once you get approved of like, okay, we know that people who take this medication also have problems most likely swallowing. So this is going to be like a no-brainer where we don't really want to go after ones that are something where it's like a one-time pill that you take once, and it's usually for people 18 to 24 who are active type of thing where it doesn't make as much sense. Do you have a kind of like a hierarchy like that you're kind of waiting on the sidelines for?
No, look, there's definitely a commercial hierarchy, and again, we're looking and focusing on drugs that have very large take-ups. So from that perspective, we are focusing on existing drugs that are out there, existing powders and pills and tablets, and focusing on turning those drugs into gels. So that'll be the first cab off the rank, so to speak, and then we'll focus on a lot of the others that are out there, and then start looking to or having further conversations with pharmaceutical companies, to figure out how we can turn some of their existing APIs into gels as well.
I've talked to a few different people on the podcast who've been waiting FDA approval, and none of them seem to be as lucky as you or as smart as you to have a kind of like consumer version of the product that you could, like the nutraceuticals, where you could be selling it right out the door, have revenue coming in the door while you wait. A lot of them just seem to be waiting around, and all they do is spend money, can never make any money.
Mm-hmm.
How much of that was a conscious decision that you thought, okay, not only is this gel thing going to be revolutionary for the pharmaceutical industry, but also for everyday people who are just trying to be weekend athletes to pets, where it's going to be easier to get approval? How much of that was that, like, you knew going into it that it could actually be revenue producing day one?
Look, to be honest, I think that was actually a set goal for us. And again, you're only as good as your weakest link. We've got a really smart team at Gelteq, both on the R&D side, but also on the commercial side. Now, we are lucky in a way that, again, a lot of the verticals that we've actually developed products for are available for immediate sales, as you said. So again, being able to generate revenue, being able to get products and market adoption immediately and early is critical to our business and our strategy. Meanwhile, we do have that in that pharmaceutical space, and again, going down the B2, that accelerated pathway, also means that we can get drug-based gels on market a lot quicker as well. So everything we've done has been designed to get products on market and get revenue generating into the business.
Yeah, because you're like piggybacking on someone else who's already done like a lot of the FDA trials. Mm-hmm. Yeah, is that why you can kind of expedite it, where you go, okay, we don't need to do a double blind since they've kind of already spent all the money on this, and this is just a new delivery? How does that work, where you get to kind of piggyback off someone else's discoveries to make sure that they can prove it's safe that much faster?
Yeah, look, absolutely. I mean, going down the 5B2 saves us a lot of problems. A lot of the work's already been done. We're showing bioequivalence, so it's not like we're bringing a brand new drug to market, which costs a lot more and takes a lot more time. So we've tried to be quite strategic in what we've done, and the ability to go down this 5B2 means that we can have drugs on market a lot quicker, and then we will continue the conversations on the pharmaceutical side with groups who want to develop new gel-based drugs, in which case we'll have those conversations as well.
And I can't hold you to it because you never know what the FDA is going to do, but where do you see in your roadmap approval? Is it like 6 months from now, or like 28 months from now, or like where kind of on that spectrum do you guys are planning?
Look, I can't really give a response. I would think sort of within the next 12 to 24 months, we'll start seeing some approvals come back, assuming that everything is in the right order and everything is as it should be.
Makes sense. No, yeah, it's tough for me as a layman to know where things are in this FDA, because sometimes it's like just at the finish line, or sometimes it's just started, and it's hard for me to know what all the different type of trials people have to do, where they're at. But no, it's exciting that at least it's on the horizon somewhere, kind of thing.
Well, it's short term, right? And I think that's the benefit of Gelteq as a business, is the fact that we go down that 505B2. So it's short term on the drug side, but there's also immediate with the nutraceutical, animal, human health space as well. So it means there is stuff constantly happening in the business every day, which is exciting.
Oh, 100%. So as we wrap up here, last kind of question is, what gets you up in the morning? What gets you excited about Gelteq? What do you think? Is it helping people who have trouble swallowing? Is it just introducing it to the whole world in every single fashion? Or what makes you excited?
Look, all of that. I mean, I think we're solving a very real problem. I mean, there's 1 billion people there who have problems taking medications, and there's probably another 1 billion who would like to find a better solution. So I think from that perspective, we're actually helping people and genuinely helping people live better lives. But also, I find the technology incredibly exciting. I mean, again, we do run a full-time lab. There's always things happening. There's always new products. There's always new things that are actually being developed in the business, which is great. And also, it's just started. People are just starting to find out about Gelteq. So from our end, the next sort of 12 to 24 months is incredibly exciting as we take a global approach where we've just launched our new offices in the US. So from our end, the US plays an integral strategic focus for us. So, we'll be spending a lot of time on that. And also just trying to grow the business. And, we're now public, as you said. So again, there's a lot to do on the public side. But, it's all exciting for us. I mean, we love the technology, but we also love people. We love clients. So it's a matter of working and getting hard and getting this solution out to as many people as we can.
Awesome. Well, as you mentioned, the stock ticker, I'll mention it one more time. It's GELS, awesome stock ticker, GELS. Makes all the sense in the world. If people want to hear or learn more about Gelteq, what you guys are all up to, where should I send them?
Look, send them to the website, Gelteq, GELTEQ.com. I'm always happy to have a conversation with anybody. If anybody knows me, I love a phone call. I love a coffee. So Simon at Gelteq, again, Simon at GELTEQ.com. Very happy. Please reach out with any questions, comments, feedback, and we'll get to everybody. So it's our love, our drive, our passion is all about getting this story out to people. So always happy to talk about it.
Awesome. Well, thank you so much for coming on the podcast. And for those still listening, please remember to subscribe and review. Thanks.
Thanks, Will.
This podcast is for informational purposes only and does not provide financial, legal, or any other advice. The information is not investment advice or any offer to buy or sell any securities or to make any investment. The views expressed by the guests are their own, and any reference to third-party products, services, or information does not constitute an endorsement therefor by NanoCap Podcast or its affiliates. The NanoCap Podcast express disclaims all liability for any individual's use of the information presented